In the middle of a global pandemic and with so many questions about this new Omicron variant, many folks have put off routine medical appointments and screenings, but most doctors have one word of advice: don't. Today, on this Giving Tuesday, I want to talk about an issue that's very important to me personally: the fight against colorectal cancer. According to the Colorectal Cancer Alliance, there have already been more than 149,000 colorectal cancer cases this year. 1 in 24 people on average risk developing colorectal cancer in their lifetime. And over the past few years, we've seen a disturbing trend. More young people contracting the disease as well. I want to bring in Michael Sapienza, the CEO of the Colorectal Cancer Alliance, and Dr. Kimmie Ng, the director of Dana-Farber's Young Onset Colorectal Cancer Center. I do want to mention, in full disclosure here, I'm a member of the Colorectal Cancer Alliance board. I do contribute to their work as well. Dr. Ng, let me start with you. I want to start with some basics that people should know about early detection, about screening. When do people need to start paying attention, especially when it comes to colorectal cancer?
So colorectal cancer is the third leading cause of cancer in men and women. And when you combine men and women, it is the second leading cause of cancer death. New studies estimate that colorectal cancer is going to be the top cause of cancer death in young people ages 20 to 49. Therefore, recently, the United States Preventive Services Task Force lowered the age at which to start colorectal cancer screening from age 50 down to 45 in direct response to this disturbing trend of the rise of young onset colorectal cancer.
Do we know what the impetus is with regards to the rise in early onset diagnosis?
We suspect that diet and lifestyle factors and perhaps environmental exposures acting through the microbiome may be contributing to the rising rates of colorectal cancer in young people. Over the past year, we have started to hone in on some of the diet and lifestyle factors that may contribute to an increased risk, including obesity, sedentary behavior, increased consumption of sugar-sweetened beverages like sodas, and lower amounts of vitamin D in the diet all seem to increase your risk. But clearly, these are not the only factors, and so more research needs to be done to really identify the underlying cause.
Michael, let's talk about the Colorectal Cancer Alliance for a few moments here. Tell us about the work that the organization is doing to help fight this dreadful disease.
Yeah, Craig, thank you. And Dr. Ng, thank you for your expertise. Unfortunately, Craig, as you very well know, my mom died of colon cancer in 2009 on Mother's Day, and the Alliance is the world's largest colon cancer advocacy organization, fighting this disease. And, we say one simple test will save your life, whether that's a colonoscopy, a Cologuard test, a FIT test, it absolutely will save your life. And part of what the Alliance does is we help get people screened for the disease. We last year supported about 300,000 patients that were going through their treatment themselves, whether that's through our helpline or a buddy program or national conference. And then we fund life-saving research, looking at why we're seeing this young onset trend, et cetera.
How can people help this Giving Tuesday, Michael, and what would their help mean to the Alliance?
Yeah, absolutely. Thank you, Craig. Yeah, just visit ccalliance.org. Colon cancer, again, Dr. Ng said, is the second leading cause of cancer-related deaths for both men and women combined, just behind lung cancer. Most people don't know that. And your funds will go directly to helping individuals get screened, to get the research that we need out there. This is a highly underfunded cancer compared to breast cancer and prostate cancer, yet more people die of it. So yes, ccalliance.org to donate this Giving Tuesday.
ccalliance.org. Dr. Ng, really quickly, can you give us an idea of the kind of progress that's been made over the years against colorectal cancer?
We have seen actually a steady decline in the incidence and death from colorectal cancer in people over the age of 50. And that's largely because there has been improved uptake and compliance with screening recommendations. I cannot emphasize enough the importance of getting screened starting at age 45. This will help prevent the development of colorectal cancer, as well as detect the cancer at an earlier stage when it is more likely to be cured.
ccalliance.org. Kimmie Ng, Dr. Ng, thank you so much. Michael Sapienza, thank you as well. Keep doing the Lord's work. Thank you.